Hello everyone, how are you? This is the second video of the series of lecture related to pharmacological agents of autonomic nervous system. In this video, I will talk on the location of cholinergic receptors. At first, there are two types of receptor in cholinergic system. Number one, muscarinic or M type of receptors, who are 5 subtypes: M1, M2, M3, M4 and M5, and the nicotinic or N type of receptor, which are NN and NM type. Now, where or in which tissue in our body these receptors are located? To understand the location of receptor in cholinergic system, we should understand the functional anatomy and physiology of autonomic nervous system. The autonomic nervous system consists of parasympathetic and sympathetic system. This is the central nervous system, consists of cerebrum, cerebellum, midbrain, pons, medulla oblongata and spinal cord. For easy understanding, I have drawn 3 fibers, and these are the preganglionic fiber. These 2 fibers are parasympathetic system and this 1 fiber is in sympathetic system. These preganglionic fiber meet with postganglionic fiber, and the meeting place of preganglionic and postganglionic fiber is called the ganglion. What is ganglion? Ganglion is nothing but the collection of cell body outside the central nervous system, and the collection of cell body inside the central nervous system is called nucleus. Very important question in your exam viva. Collection of cell body in central nervous system is called nucleus, and the collection of cell body outside the central nervous system is called ganglion. Ganglion are maybe in parasympathetic system and sympathetic system. Now, these are the postganglionic fiber which supply their respective tissue. Now, again come to the preganglionic system. The preganglionic fiber, both in parasympathetic and sympathetic system, release same type of neurotransmitter, that is acetylcholine. Mind it. Both in parasympathetic and sympathetic system, the preganglionic fiber release the same type of neurotransmitter, that is acetylcholine. And the released acetylcholine act on the postganglionic membrane. And the receptor located in the postganglionic membrane is single type, that is nicotinic type, very specifically NN type, NN type. Now, being stimulated, the postganglionic fiber in parasympathetic system release the neurotransmitter acetylcholine in their respective site of action, and in sympathetic system, the postganglionic fiber release the neurotransmitter norepinephrine or noradrenaline. This is the rule, but in sympathetic system there is some exception. There are some tissue like sweat gland, few cutaneous blood vessels, electrophylogram, where the sympathetic postganglionic fiber release the neurotransmitter acetylcholine. Mind it, acetylcholine instead of norepinephrine. I repeat again. In sympathetic system, postganglionic fiber usually release the neurotransmitter norepinephrine, but there are some exception where instead of norepinephrine, postganglionic sympathetic fiber release acetylcholine, where in sweat gland, few cutaneous blood vessel, erector pylorium muscle. And in this tissue where acetylcholine is released in sympathetic system, the receptor is M type, not N type. Now come to the parasympathetic system. Postganglionic parasympathetic system release the neurotransmitter acetylcholine. The target tissue of parasympathetic system can be divided into two groups. At first, the second group. In second group, the postganglionic fiber supply the skeletal muscle, and the junction between the postganglionic fiber in parasympathetic system and skeletal muscle is called neuromuscular junction. And the released acetylcholine act on the receptor type NM, nicotinic M type, NM type. And the first group of parasympathetic system, the postganglionic fiber supply all other tissue, this smooth muscle, where the receptor are M type, various subtype M1, M2, M3, M4 and M5. Very important to understand that these target tissue are called neuroeffector site. In the neuroeffector site, the receptor are M type, and in the neuromuscular junction, where the postganglionic parasympathetic fiber supply the skeletal muscle, is NM type. And besides these parasympathetic and sympathetic system, in the central nervous system, both the muscarinic and nicotinic receptor are located. For easy understanding, in the cranium, brain matter, the muscarinic receptor are located, and in the brain stem and spinal cord, nicotinic type of receptor are present. So on this, after this discussion, we can summarize the location of cholinergic receptor. Number one, central nervous system. This is the central nervous system where both muscarinic and nicotinic type of receptor are present. Number two, the ganglion. The ganglion where both sympathetic and parasympathetic ganglion, the nicotinic N type receptor present. And number three, neuroeffector site. This is the neuroeffector site such as eyes, bronchial tree, lung tissue, GI tract, urinary tract, genital tract, cardiovascular system. This is the neuroeffector site where the receptor are muscarinic type. And number four, neuromuscular junction. This is the neuromuscular junction where the receptor are nicotinic type, NM type. For brief summary, in parasympathetic system, muscarinic receptor are present in the neuroeffector organ and brain, and nicotinic receptor are present in the ganglion and neuromuscular junction and in spinal cord. This is the last thing. This discussion will help you for your easy understanding of receptor location of cholinergic system. Thank you very much for your watching. Thank you.